Good evening, everyone. I am Dr. Amit Gupta, and I am speaking live from the Lisbon. That is the venue of the IDF World Congress 2022, and we had so many exciting sessions here, which I have witnessed here, and I would like to bring some of the sessions, new learnings from these sessions to you. And one of these is about the diabetes technology. You know that diabetes technology is very important, and it is going to be used in a big way in coming years to improve the lives of people living with diabetes. So one of the session which I attended and chaired was on diabetes technology, and it was on the and it talked about a new metrics in diabetes management. It is about the GRI, that is the Glycemia Risk Index, and it was Dr. Christophe from the Belgium who spoke on this topic. And as you know that nowadays we are targeting the glycemic heptagon. We talk about the mean glucose levels, then we talk about the SMBG, then we talk about the HbA1c. We also talk about the other parameters like time in range, time above range, and the time below range. We have seen that the persons living with diabetes, those who have similar kind of SMBG may have totally different HbA1c levels. Those with similar kind of SMBG and HbA1c may have a totally different time in range. And GRI has told us that sometimes the time in range may miss to identify those people who are having very low, very higher risk of hypoglycemia, as well as those who are at very risk of hyperglycemia. So GRI is a novel index which adds another layer to the analysis of the glucose data which we get from the CGM, and it tells us about the risk of hypoglycemia as well as the hyperglycemia in persons with diabetes. So whether this new marker is new metrics is going to have some clinical value and how we are going to take up in this clinical practice, I think you should watch this session on the IDF website, where you can see the entire recording of this talk, and it will make you more wiser. Second thing, I would like to talk about another topic which was discussed and talked about by Dr. Julia Mader, and Dr. Julia talked about the CGM, use of CGM in primary care practice. We all know that CGM is there for so many years, but most of the time the use of CGM remains underutilized, and what we see maximum is it is seen as a non-invasive method of glucose monitoring, where you can avoid the finger pricking and see your glucose levels, but it is much more than that. It gives you an idea about your glycemic variability. It tells you how much time you are spending in range, how much time you are in the hypoglycemia, or how much time you are above the range, that is in the hyperglycemia. It also allows you to change your therapy. It allows you to tailor the therapy as per the requirement of the patient and as per the glycemic variability of the patient, so you can attain better glycemic results with the use of tools like AGP and TIR, TAR and TBR while using a CGM. So it is important to understand that the CGM has a very good clinical value. You need to identify the right patient, and it has to be used to its full potential to get the clinical benefits of the CGM. There are studies which have shown that if you minimize the glycemic variability, then you get benefits in terms of microvascular complications as well as the macrovascular complications. Third thing which I would like to talk about is the use of apps called diabetes apps in the management of the diabetes. These apps can be divided into different categories, and these categories include the apps which may be there for the monitoring, app which may be there for the decision making regarding the insulin doses. The apps may be there to get the data from the CGM devices or to direct the insulin pumps, or there can be apps which can modify the health behavior. So it is very important to understand that there are different apps which are available, and these apps as a healthcare providers, we should be aware of what is there, and some of these apps are even certified by the associations and the organizations, and they are called digital therapeutics. So these digital therapeutics are actually given like a prescription, and they can help the patients with diabetes in improving their lifestyle, in improving their glycemic control. So I think this is again very important. Another important thing is that there is another study which was presented today, and the name of the study is Dinova, and this study was presented by Dr. Laurie from USA, and she presented the data on the use of linagliptin and empagliflozin in patients with type 2 diabetes, youth onset type 2 diabetes. So I think the data was very promising, and it tells us that The empagliflozin can be used even in youth with type 2 diabetes, and with the almost very minimal or no risk of diabetes, diabetic ketoacidosis. Another key session was again in the morning, where Dr. Shashank Joshi headed a panel which talked about the diabetes care across the ages and across the globe. So we need to understand that different countries, different regions, they have a different need, as well as the patients in different age categories or the age groups. So the panel highlighted the importance of individualizing therapy as per the age, as well as it also stressed upon the importance of using technology, and also using considering the region-wise perspective or the population-wise perspective of different regions in taking a decision related to diabetes care. So I think you have a lot of things to look forward to for this IDF Congress 2022. You can still register and watch the sessions live or the recorded also. So with this, I would like to say goodbye to you for now, and wish you a good day. Thank you very much.